morning, everyone, and welcome to our webinar presentation for today, Beyond the Basics, Active Listening for Trauma and Violence-Informed Care. My name is Andrea Bodkin, and I am a Senior Program Specialist in Health Promotion here at Public Health Ontario, and I'm with the Chronic Disease Injury Prevention team, and I have the pleasure of moderating today's session. I'd like to tell you a little bit about the land that we are on today. The work that we all do take place on traditional Indigenous territories across the province. In the province of Ontario, there are 46 treaties and other agreements that govern what we now call Ontario, including Treaty 13 and the lands associated with the Toronto Purchase, which is where I'm speaking to you from today in downtown Toronto. I'm thankful to the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and are still here, living, working, playing, laughing, and teaching on the lands of Ontario, contributing to the strength of this province and to all of the communities across it. I'd also like to share with you one of my personal commitments to truth and reconciliation, in addition to doing land acknowledgements, and that is a commitment to the two-eyed seeing teaching. And that is seeing with one eye from my Western perspectives, my own personal life experience as a cisgendered white settler, the things that I have learned in school and through my work and the interactions that I have every day, and with the other eye considering Indigenous perspectives, ways of knowing and being. And whenever I am doing a webinar, researching, speaking with folks, reading, trying to reflexively think, what about Indigenous peoples? How would this particular issue I'm reading about impact Indigenous peoples? What do I need to know from the Indigenous perspective? So as you're sitting, learning, listening today, I'd encourage you to think from those two eyes, your own way of knowing and traditional ways of experiencing, Indigenous ways of experiencing what you're hearing. So I'm going to move on to a couple of housekeeping items. We have disabled participant audio and video just to enhance the quality of the presentation. We don't have a chat pod enabled today because there are so many of you, over 700 people registered today. And if we are going to enable the chat during the session today, we will let you know. You can use the Q&A pod at any time throughout the webinar today to ask questions. You can anonymize your questions if you like, and we're going to have a discussion and question period after the presentation. If at any point you have any technical issues today, you can email capacitybuilding@aohpp.ca. I'm going to introduce you now to my co-moderator for today, Dr. Susan Jack. Dr. Jack is the lead for the Public Health Nursing Practice Research and Education Program. Susan and her team are committed to integrating the principles of trauma and violence-informed care into professional practice and curricula as a strategy to improve client engagement and health outcomes, as well as to promote provider wellness. I'm going to pass it along to you, Sue.
Great. Thank you so much, Andrea. Good morning to everyone. I am so grateful to Andrea for co-moderating with me today, and always grateful to Public Health Ontario for their partnership and incredible technical support in hosting and archiving these monthly webinars. We couldn't do it without this partnership. And in today's webinar, we will present active listening as an advanced skill that includes preparing to listen, mindful presence, and responding in ways that indicate listening and, more importantly, understanding. And I'm really excited for this presentation today. I've taught nursing for almost 2 decades at McMaster University. I've been a nurse now for 30 and a bit years. And I've had many conversations about active listening, and in asking public health nurses or family home visitors or undergraduate nursing students, what's active listening? And the response is always the same. It's having an open body, looking, making eye contact with our client, nodding our head in agreement, being non-judgmental. And I probably am not alone in just having this basic understanding of what active listening is. And I'm really excited today given that active listening is a core skill in relational practice. And relational practice is central to providing trauma and violence informed care to the clients and the individuals and the families that we all work with. So today with Dr. Orr, we're going to be moving beyond these basics. And we're going to move beyond the basics of active listening so that this can help all of you to really unlock your potential of this powerful trauma and violence informed care tool or strategy. So it's my pleasure to introduce Dr. Elizabeth Orr. She is an assistant professor at Brock University Nursing Department, where she teaches communication and relational practice to undergraduate and accelerated nursing students. And her research focuses on parent and child health, specifically in hospital home transitions for infants and families in neonatal intensive care. So welcome, and over to you, Liz.
Thank you, Sue, and thank you to everyone for taking the time out of your day to join us in this webinar. And I'm really excited for all that are attending and for this opportunity to talk about active listening. And I want to emphasize that I'm joining you today not as an expert in the field of communication. I'm not saying this to be self-deprecating, but really to emphasize that I am here as a fellow nurse, clinician, teacher, learner, parent, partner, colleague, looking for ways to engage in meaningful relationships with my clients, colleagues, students, my partner, my kids. And really this led me along this journey of trying to understand listening better and understand how active listening can be such an important part of having these meaningful relationships. And so what I'll be sharing today is this understanding that I've developed over a number of years in all of these roles, and the importance of listening, particularly that skilled, active listening, and how it's beyond a basic skill, beyond a basic that we learn one time and that's done. And also how this is an extremely valuable tool in your trauma and violence informed care toolbox, as Susan mentioned. So excited to be here today, and let's get started talking about active listening. So I would like to start by sharing with you today the moment I really understood that listening was more than a basic skill. It was the day that I received this letter from a family of an infant that I cared for in the neonatal intensive care unit a few months prior. I cared for this family while their baby was dying, and our shift together was the last day this family had with their son. And if you asked me before I received this letter what I had done on this shift to receive such thoughtful words from this family, I would have had a hard time answering. Because as nurses and other care providers, I imagine we are conditioned to evaluate our days based on the number of tasks we perform, the procedures, assessments, all of these things that we can check off as completed. And I might have even said that I had done nothing this day, because when a baby is dying, there is really very little to do when we think of doing things as tasks. But as I reflected on this letter, and I came to realize everything that I had done this day. I was listening. I was holding space for emotions. I was silent when I needed to be so that I could just have my presence with this family. And all of these skills that I used impacted this family in this way. It had nothing to do with tasks, assessments, procedures. It was my listening, my presence. And it was this day that I really came to understand how important active listening could be. And that's also why I chose to title my presentation as Beyond Basics, because hopefully after our short time together this morning, you will have an understanding the power of listening as a therapeutic tool. And at the very least, think twice before you equate skillful listening with doing nothing when compared to tasks or procedures. So where can we begin? Let's talk a little bit about some of the understanding of how we can harness this powerful tool that can be that is active listening. So first, we need to really understand that active listening is more than assigning meaning to the input that we bring in through our ears. And it really requires paying attention. It requires understanding. It requires us to remember things that were said in a conversation and then ultimately responding. And even this may sound simple, but as you've likely experienced on a regular basis when engaging in conversations, paying attention is particularly hard when we're stressed, particularly hard if we're distracted, or there's things consuming our interactions, noises, sounds, our own thoughts. Understanding and remembering is even harder when we're distracted. And sometimes we can be so focused on the response that we're trying to generate in our mind that we're missing some of these preceding steps. So I really do find it helpful to think of active listening as a cycle of steps that we can practice. And when we practice these skills, we can then support these components of active listening, the paying attention, the understanding, the remembering and responding that is so important. And so these steps can be preparing to listen, listening to and for, and then responding. And we're going to explore each of these in a little bit of detail with some practical steps on how you can integrate them into your practice to really improve those listening experiences that you're having with clients and families. So I really like this quote. Expert nurses come to realize their being is as valuable as their doing. And this quote, I love it so much because it really summarizes that aha moment around the importance of active listening for those meaningful nurse-client, clinician-client, even those interpersonal relationships in our personal lives that are so important. And it highlights also the expertise that is required to perform this skill. This is something that experts do if we realize that being is more valuable than our doing. And so how do we go about doing this? How can we prepare to listen in such a way that our being can be more important than our doing? So when I think about preparing to listen in this way that is meaningful for our clients, we really need to think about how we can prepare our minds in such a way that we are ready to listen. And so mindfulness is often described in the context of ourselves and our self-care or wellness. But today I really want to focus on how mindfulness and mindful practice can have a benefit for those interpersonal relationships and our communication skills and lead towards those meaningful relationships that we want to have with our clients. And so again, you've likely heard some of the benefits of mindfulness towards self-care, towards wellness, but there are some evidence that really points to demonstrating that practicing mindfulness can increase your ability to see another person's perspective, to identify emotions, to be accepting of emotions. It can actually strengthen those pathways in our brain that are used for communicating empathy, as well as the ability to see people holistically so that we can see the whole person in front of us versus their biological parts, the processes that we might be interested in as clinicians. And so by practicing mindfulness, you're not only going to benefit personally for things like burnout and stress reduction, but you can strengthen those interpersonal skills, especially listening. So when I talk about preparing to listen, and I talk about this especially with some of the students that I teach, mindfulness is really central to this preparation and incorporating some mindful practice into your daily routine or into that skill building that you do when you want to become a better clinician. And so what is mindfulness? The common definition proposed by Kabat-Zinn is the awareness that arises through paying attention on purpose in the present moment, non-judgmentally. But I happen to prefer a simpler definition that really is about putting your mind and your body in the same place at the same time. And I like this because it really simplifies, what am I doing when I'm practicing mindfulness? And if you had the opportunity or the pleasure to attend Dr. Lucy Houghton's webinar last month, she gave some really tangible strategies in her grounding exercise that really explain what it means to put your mind and body in the same place at the same time, while also focusing on that practice of gratitude. And so when you're thinking about doing these things, it's going to help you be able to be in the moment, and really understand what is important to prepare for the interaction that you're going to have when you want to be actively listening. So what can preparing to listen look like, actually? So we have kind of the why we might want to practice mindfulness, that it might be helpful in these interactions that we'll be having with our clients. But how do we actually apply this to active listening? So using mindfulness practice or using mindfulness principles to prepare can look kind of like this process or this progression. And really, the first thing you want to do if you're wanting to apply the mindfulness principles to support your active listening is to take a moment and focus inward. Look at those thoughts, those emotions, those physical sensations that you're experiencing in that moment. What are you feeling? Are you angry? Are you sad? Are you feeling any sort of emotion, irritable, frustration? What physical sensations might you be experiencing? Are you tired? Are you hungry? Can you think clearly? Are there certain facts or principles that might be informing their situation? Take a moment and look inward at these three aspects: your thoughts, emotions, and physical sensations. And then if you deliberately evaluate these, you can understand how they may impact your ability to pay attention, to understand, to remember, and respond, are aspects of active listening. And so you can think to yourself, how might my emotions interfere in this situation with my ability to pay attention? Am I feeling something that's going to make it difficult for me to listen to this person that I'm planning to have a conversation with? Are any of these thoughts, feelings, sensations that I'm experiencing coming from biases or faulty assumptions? And if so, are these going to affect my ability to understand what the person I'm trying to engage with is truly saying? And what might I need to do to self-regulate or calm down or meet my own basic needs so that I can listen effectively? For those of us who've worked shift work or know that what it looks like to schedule appointments back to back to back, and we give really little time for our own personal needs. You maybe are skipping lunch, you maybe haven't had a chance to use the washroom, but maybe taking care of your own needs first are going to put you in a place where you're going to be able to listen more effectively. If you're irritable when you're hungry, how are you going to give that proper attention to the person that you're trying to engage with? So that's what this can look like when you're preparing to listen and using some of these mindfulness principles. You can really assess that current state, the physical, logical, emotional states of mind, and understand what it makes sense to do first. Maybe you need to address some of the biases. Maybe you need to look towards what you need to do for your own self-care and move forward with that action plan before you're ready to actually listen. And so only after mindfully assessing in this way can you be truly ready or prepared to listen. So we've prepared our mind, we've prepared, hopefully we're physically, emotionally, and feeling ready to listen. How do you communicate this to somebody? And this is where I'm going to ask if we can open up the chat pod, because I'm curious to hear your responses to this question. How do you let somebody know that you are ready to listen? You're there and you are ready to hear what they have to say. Happy to hear some of your thoughts as far as how you communicate to someone you're ready. You've done that preparation work. Excellent. See, eye contact, body language. You can tell them, turning your body towards them, nodding, telling them, smiling. I love that. Being explicit, telling them open-ended questions, being direct. Excellent. Nonverbal body language. Fantastic. All really excellent ideas of how we can really communicate with somebody that we are ready to listen to them. And really, when I think of being prepared to listen and showing somebody that I've done this preparation, body language can be that very powerful form of communication. And so when we talked at the beginning about not active listening being not just body language, we do still need to talk about the importance of making sure somebody can see through our body language that we are ready to listen. We may have prepared very well in our mind that we are ready, but if we're not communicating that outwardly with our behaviors,
that individual is not going to receive the message that we are prepared to listen. And so I really like the idea that body language of active listening is called attending. So we are attending to that individual, and attending communicates that I am here and you have my attention. And so we do still need to be aware in this preparation of what our body is saying to the individual we're looking to engage in a meaningful way with. And so there's an acronym. You've likely maybe come across some helpful tools that help you remember what the body language or the attending posture would be when you're preparing to listen. And this one may be new to you, because Stickley proposes an acronym to help us remember some of these important aspects of communicating our readiness to listen, with an important addition to previous models that are typical in communication literature, communication textbooks, even in the nursing and other helping professions literature. And that is the addition of this Y at the end. And the Y stands for your intuition. And this really accounts for the cultural and contextual complexities of therapeutic communication, and really speaks to that beyond basic nature that active listening in nursing can be. And so that nurses need to use that expert knowledge, their judgment, to really get this right. And so we can have reminders to, sit at an appropriate angle to make sure our posture is open and relaxed, that we are maintaining appropriate eye contact, making sure we understand that there's cultural and contextual nuances there. Same with touch. And that's why I really appreciate the addition of this aspect of intuition when we're preparing to listen and showing the individual that we are ready. So another question to the group, and I will ask for the chat pod to be opened again. And my question now is, so we're moving from preparing to listen to actually engaging in a conversation. And we often know who we are listening to, but what exactly are we listening for? And so I'm curious to know what your thoughts are when you're actively listening. What are some of the things that you're actually listening for? Feelings, needs, the story, the emotions, details, tone, things you can help with, risk, pace, love, all of these responses, point of view, triggers, emotional experiences. Fantastic. I knew with this group, we would have so many wonderful and thoughtful answers. And that's true. We're listening for so many things. And it's really simple to think of listening to as the person. We can say, I'm listening to my client, I'm listening to this family. But when we really reframe listening as listening for specific things, it can be very helpful in understanding how listening is this beyond basic skill. So we're listening for certain things. And oftentimes in our interactions and our conversations, we're listening to gain some sort of knowledge. And so this can be specific content knowledge, the who, what, where, when, types of responses that we get to some of our more specific questions. It may also be in response to more open-ended style conversations, but the content is really satisfying some of those details. But we often combine the content with our observations as well, and our observations help us gather more information. It helps us understand maybe some of what is not being said, and all those excellent answers that brought forth, that you're trying to understand things like energy or mood and emotion. And so we often combine the content that somebody is speaking to with our observations, which helps us get at some of those feelings or emotions. And so this helps us to gather more information. And we also often are concerned with how somebody feels about a certain situation. And because people rarely state their emotions explicitly, except for maybe toddlers, very few people go around saying, I am sad, I am mad. We're having to listen carefully for the content and the observations that are going to provide insight into somebody's emotions. And as we start to combine this content, our observations, we start to get an idea of the emotions behind some of these things that we're hearing.
we start to bring this information together towards a theme. And as we start to understand the theme of somebody's message, that is helping us to understand what is really going on in their situation. When we can combine these content of the message, some observations, feelings, and then move towards that theme where we're really starting to truly understand something about someone. And often when we engage in active listening that is therapeutic, we need to be even more intentional about listening in this way. So again, moving beyond who we're listening to and what we're actually listening for can be so important. And so I really like this quote from Doan and Varco from their book, How to Nurse, which is just, if you need a recommendation on a book for relational practice, it would be the one to go to. But this quote really articulates so well how when we move beyond listening for basic content or simply to generate knowledge and move towards understanding, we can start to listen in such a way that is truly therapeutic. And so how can we really listen for beyond that knowledge so that we can get to that place of understanding? And Doan and Varco really do offer some good suggestions of things we can intentionally be listening for so that we can come to that place of understanding. And so we might want to be listening for significance or meaning. What is it really like for this client or family in this situation? And we really want to be listening with that significance or meaning in our mind. Or how about the socio-contextual influences? How are things like economics, policies, values, norms, traditions, history, racism, sexism, ageism, so on? How are these shaping this family's situation or experiences? We might want to listen intentionally for capacity. What challenges are facing this person or family? What capacity or inner resources does this family have? And so when we want to move towards the place of understanding, we often need to be listening specifically for certain things, intentionally focusing on what that situation is like, intentionally focusing on the meaning they create from their experiences, or purposely seeking examples of strength in a client's narrative. And so when we think in this way, and that actual act of active listening is to be clear, we're not only listening to someone, but we're also specifically and purposefully listening for certain things. And that can really lead toward that listening for an understanding, which is really when we look at how people feel listened to, it's when they feel understood. And so that leads me, and I've maybe given a hint as far as the next question, but I am going to open the chat one last time. And I really would like to know, putting yourself in the position of the person who is being listened to, how do you know somebody has actually listened to you? When you've told your story or been in conversation with someone, how do you actually know someone has listened to you? Excellent. I'm seeing validation, rephrasing, summarizing, mirroring what they've said, using techniques that reflect back, paraphrasing, repeating. Fantastic. These are all such important ways of letting somebody know that we have been listened to. And it really is all about that response. So as we can have done all the work of preparing to listen. We can be in a good place physically, mentally, and emotionally to listen. We can be performing all the best body language and focusing on that individual and making sure that we're respectful of space but if it comes down to the fact that we aren't able to respond in a way that demonstrates that we've listened or a way that we truly understand, all of those first steps of active listening may be lost. And so we're going to move on to this final phase of our active listening cycle, where we really need to know how we can respond to others so that they truly know that we've listened and are working towards understanding. And so there are different types of responses. There's different types of responses that we use in different situations, and all can be appropriate at times, but not all responses can truly demonstrate that feeling of being understood. And so many can indicate listening, but not all demonstrate that level of understanding that we're hoping to achieve in our therapeutic relationships. So types of responses like questioning or reassuring, analyzing, advising, these are common responses used by clinicians. But when we compare them to an understanding response, you can see where the others may leave a client or family feeling like they have not been fully heard. So often we tend to rely, especially as nurses or clinicians, in helping our caring professions or helping our caring roles. We tend to rely on advising as our listening response. And it's often good intentioned advice. But when we think of advising and we look at the examples on the screen right now, you can see how that advice, well-intentioned, maybe leave a client feeling misunderstood. If that advice is provided maybe before we've come to a full understanding of their situation or understanding of the meaning behind their narrative, it may feel like we actually haven't listened, even if we've done the preparation. We've listened to and for, but it's so important that that response demonstrates understanding. So there are certain skills, and many of them you identified in the chat, that can really help individuals in our response feel like they are understood. And so what does a response for understanding actually look like? So responding with understanding can look like paraphrasing. It can look like seeking clarification, reflecting feelings, connecting thoughts and feelings, and summarizing all of these things that you already populated in the chat. And so you understand how important that response is. And really, when we look at these skills, they don't need to be overly complicated, but it does require suppressing that natural tendency to resort to our preferred style, which is often advising or sometimes reassuring. And we really need to practice these skills of responding that demonstrates understanding. And so when we look at paraphrasing, seeking clarification, reflecting feelings, connecting those thoughts and feelings together, and summarizing, it's these types of responses that, when presented tentatively and allow the client to feel understood, it can open that dialogue for continued understanding. So for example, if I were to say to you, wow, that must be really frustrating after you've told me that you've been put on hold for the third time today while trying to book an appointment. It gives you an opportunity to say, yeah, that is really frustrating. And then we've reached a shared understanding. Or when I've phrased it in this way, a little bit tentative, it gives you the opportunity to say, well, it's more about the amount of time that it's taking out of my day. I'm already so busy. And then it gives me the opportunity to try again, to respond with understanding using this new information related to time or feeling busy. And we can go about that back and forth of using or understanding response until we can get to that place of shared understanding. And so each of these can lead to that shared understanding between individuals in our interpersonal relationships, in our therapeutic relationships, that ultimately leaves the other person feeling like they were listened to, or it continues the dialogue along that goal. And if we think of the opposite example, if I were to say, after you told me, you've been put on hold 3 times today while trying to make an appointment, if I were to say, well, you should try emailing the office next time, you may not feel very understood, and the dialogue is likely to end without that back and forth to achieve that shared understanding. And either yourself or both parties are going to leave that conversation feeling unsatisfied in either just the conversation, more importantly, and potentially worse, the entire relationship. And so the importance of demonstrating understanding in our responses cannot be overemphasized. So how do we bring this all back around to our trauma and violence informed care approaches that we want to be practicing with our clients and families. And so we've completed the cycle of looking at active listening in that we're preparing to listen, we're listening to and for, and we're responding. But I really want to emphasize that these skills, when practiced well, can be a powerful tool in your trauma and violence informed care toolbox. And so to highlight this point, I've mapped our active listening principles and skills onto the principles of trauma and violence informed care to demonstrate how active listening can really go a long way in providing that TVIC level of care at the clinician and family interaction. And I think this is something that we can all agree we're striving for in our practice. And so when we think about understanding trauma and violence understanding trauma and violence and their impact on people's lives, we can really think about how we are preparing to listen, how we're preparing to listen in such a way that accounts for our own personal biases and assumptions, and challenging these so they don't impact our ability to listen. We can prepare ourselves for the possibility of hearing narratives of trauma and violence and ensure that we are emotionally, physically, and mentally prepared for this, both in our listening and in our responding. We can also be listening for those influences of socio-contextual factors in our clients' narratives, knowing that we can help people who may be experiencing trauma and violence, even without a disclosure. So that's how we can satisfy that first aspect of trauma and violence informed care. How about for creating emotionally and physically safe environments? Again, using our principles of active listening, we can use those skills of attending, those skills that with our expert intuition and our expertise as clinicians and nurses to foster safety and trust. We can listen for and respond with understanding, which facilitates feelings of dignity and respect. If we want to be fostering opportunities for choice, collaboration, and connection, we can also use our active listening skills. We can listen for that significance or meaning to inform our shared decision-making or to inform our collaborative service planning. Again, we can be listening for and responding with understandings so that we're constantly confirming that we are understanding the client's or family's perspective. And when we look at those strengths-based and capacity-building approaches from our active listening tools, we can be listening for meaning, capacity, and strength to improve engagement and empowerment. And we listen for those socio-contextual influences to acknowledge the impact that these factors can have on people's lives. And really, this is the important point, and the final point that I'd like to make here is that while not a basic skill, active listening is low tech, it's low budget, it's simple to practice, it's adaptive to culture and context. So these skills can lead to meaningful interpersonal and therapeutic relationships that promote health and healing and prevent harm in the way that we're hoping to with our clients and families. And I really want to thank you so much for joining me today. And I'm going to pass it over to Sue for some questions.
Great. Thank you so much, Liz. And we will now move to the question and answer pod to address some of your questions. Please continue to add your questions into the pod if you've not already had an opportunity to do so. Now, Liz, one of the first questions that was put into the pod came in really early, right at the beginning of your presentation, and it's a great question, and I think you've covered some of these strategies, but I think this will be a great opportunity just to even summarize. And the question is, my challenge is I don't have a good memory, so I'm always worried in the moment about forgetting what's being said, and my mind begins to formulate responses as someone's speaking to me. So that's how I end up not listening. Perhaps there are strategies that will help me with this. Can you provide some guidance?
Yeah, I think first, you're not alone in in that feeling that there's so much when we're talking to clients or when somebody's sharing their narrative, there's so much that we are taking in that it can be challenging to feel like, wow, there's so much to remember, and so many things that I maybe want to respond to or pick up on, that you're starting to formulate those responses in your mind. I think a couple things. One, I think mindfulness and that preparation that can happen where you're freeing your mind of some of maybe those other distractions, you're freeing your mind of those thoughts that are maybe entering that are not going to be helpful to understanding the client and what they are saying, may be helpful in focusing in on what is truly important. So that would be one tip or strategy. I know with my students, we actually practice remembering. And so it's something that can be learned. So I don't think, you can say, well, I just have a bad memory and leave it at that. I think it is something that can be practiced. And so skills like listening to a narrative and pulling out what you can after can be really helpful if you're really trying to work on those memory skills. I also think that when we use the strategy of intentionally listening for something, it can also help to remove some of those distractors when we are intentionally listening for something in a narrative. So you may be focused on a particular thing that you know is going to help you towards the shared decision making that you need to have. Maybe it's towards a collaborative care plan or some purpose that you're trying to achieve with this interaction, which can also help remove some of those distractors. And so that your focus is on what you're truly listening for, knowing that you may, come back around to some of those things at another point in time. I also think it's not inappropriate to, after you've listened to somebody, to take pause and say, I'm just taking in what you have said. And so that I can be really intentional in my response, I'm just going to, it's going to be 10 seconds for me to gather my thoughts so that I can, really respond in such a way that it shows that I understand where we're at. So I think those are hopefully some practical strategies with the memory piece, because it is so important. We have to keep so much of that knowledge in our brains when we're having an interaction with someone.
Great. And thank you for acknowledging that this is a skill and it takes practice. And as people are practicing this skill, what are your thoughts of them taking notes in a clinical encounter? And how would they frame that to the client or family, just as, sort of a prompt for remembering, particularly if they're doing like a large assessment or asking a client to share their narrative or story?
Mm-hmm. Yeah, and I think that that's completely appropriate. Again, being upfront in the interactions, making sure we're creating those feelings of psychological and emotional safety, that they know maybe what we are writing down, so that they're oh, what's she writing? At the very upfront, you say, do you know what? I want to be sure that I'm not missing anything. You may see me scribble a few notes down. These are going to help me remember what we've talked about, and so that I can be really intentional about the questions that I ask and that I don't miss anything. So I do think note taking is appropriate and really a good strategy for helping with if it's memory, or even those, again, long interview style conversations that we might be in at sometimes, where we're having to recall lots of information if we do get to the end and haven't, maybe taken some notes along the way. I think that would be an appropriate strategy for sure.
Great, thank you. And I really appreciate that you've framed it in that how important it is to explain to a client ahead of time and provide that anticipatory guidance of what we're doing and why and how it'll be used. Now, the next question reminds me that as part of our work with PHN Prep, we are developing some templates to develop educational activities that public health nursing teams can use in their team meetings to develop some of these skills. So these will be developed and designed and reviewed in the next few months, and Liz has drafted one for us on this topic. So building on that, knowing that these resources will be coming, Liz, off the top of your head, do you have any practice exercises for memory that you do with your students?
it's a like a report taking style or a transfer of accountability or a narrative where one student reads it and the other student is not allowed to take notes. So maybe not, usually we are allowed to take notes in some of those scenarios, but it's brief enough that it should be something that you could hold in your mind. And then recalling back after that interaction has happened, everything that you can remember. And it really is just that practice of what did I miss? And when you're able to look at the narrative that your partner read, identifying what was missed. And often you can start to see patterns in what types of details you maybe typically missed. Is it some of the details surrounding numbers, or is it near the end that you start to lose focus, or is it the things at the beginning where you start to lose focus? And so I think that can be helpful when you start to see the patterns of where maybe your memory is needing some skill development. And then it's a repetitive process. You do it again and you see if you can, what details you can pick up better the next time.
Right. Thanks, Liz.
It's pretty basic.
No, but sometimes if you're facilitating a team meeting or an activity, it's helpful just to have these, as you call them, basic, but these ideas on how to practice these skills. So thank you. Now, here's an interesting question. What are your recommendations or best practices when someone, so if we think about a client, is clearly having a traumatic response, maybe becoming aggressive towards the clinician, and may need additional professional psychiatric care. So when we're listening and we're starting to see someone becoming activated, it includes an aggressive response. How does that impact our listening and our response back?
That is a really important question. And I do think, I will say, I do think really good active listening hopefully prevents an individual from getting to that place where they are escalating. Not that it can be avoided outright, but I do think aggression and anger comes from a place of fear and comes from a place of feeling misunderstood. So if we are really listening in such a way that we are able to, maybe we are listening for fear, we're listening for these stressors, and we're able to address them early, we can maybe prevent that escalation. So that's my one thought for that question, because I really do feel like if we're doing this well, we may be able to be more on the prevention side of escalating behaviors. When anger starts to turn to aggression, we do need to start to have some different tools. And I think that is important. We do, I'll pitch our PHN prep guidance document on de-escalation that does kind of look at this pathway from kind of fear and misunderstanding to anger and to aggression, and how we can safely engage in those ways. We may need to start using different communication skills where we're still listening, but our responses may need to be more direct. They may need to set some boundaries, and in certain situations, they may need to move to ending the conversation and either calling for help, looking at those resources of what we do when we're in situations that may be becoming unsafe.
Okay, great, thanks. And Liz, thank you for mentioning that resource. In just a minute, I'll get the link and make sure that it's shared in the chat. Okay, this next question is excellent, and probably one that many people are thinking about as they're thinking about their clients on their caseloads. How would you recommend or what are your recommendations on employing these strategies when we're working with families where there is an interpreter? Anything in particular that changes or is especially important?
Yeah. That's tricky. That is tricky. I think this is going to probably move beyond this webinar topic, and there's a lot more to unpack when we are looking at working with interpreters. But some of the basics when we are working with an interpreter is making sure that our attending is still to our client. And so that body language, that demonstration that we are listening needs to focus still on our client. And the interpreter is to the, either to the side or wherever they're positioned. Our attending still really needs to focus on that client. And some of what we're listening to, who we're listening to remains the same, but what we're listening for may be more challenging. And so we may need to ask additional follow-up questions, additional kind of exploring questions that's going to help us get at that shared understanding. I think it's more of a taking time. I think there's also some things that you can do in that preparation phase when you know that you're going in to work with a family and communicate with a family that you will be using an interpreter, making sure that you are preparing for the extra amount of time that it may take, so that you've maybe that appointment or that case is booked off more time, so you're not feeling rushed. You're able to give the same amount of attention, knowing that it's almost double time in the translation. That you prepare for, you maybe need to brush up on what it's like to work with an interpreter, so that again you're having less maybe stress and anxiety related to the experience, so that you can truly focus on the interaction and the family that you're meeting with. And I'm sure there's things that I'm missing, that there's that's out there as far as working specifically with interpreters, but I do think the principles can still apply. The time is what it's going to take specifically, and then making sure that interaction is still focused on the client, so they feel like you are speaking with them.
Thank you for, as you're speaking, Liz, I'm just really reflecting on how important it is to prepare oneself and the time required for preparation. And any administrators or managers or supervisors that are on the line today, one of the tenets of trauma and violence informed care at the organizational level is really thinking with teams about re-envisioning how time in a day is spent. And so often in nursing and other professional practice among health and social care providers, time is allocated to the task, to teaching, to assessment. Yet there's often not too much of a formal recognition of the important time that is required for a clinician to prepare to do this work in a way that promotes the emotional and psychological safety of the client. So I think that's critical, that we, particularly as we, come out of the pandemic or move into this new phase, and really are looking to support clinicians and nurses and family home visitors and professionals and their own well-being in this practice, that we think about how do we support them to do this work well. And this is leading to a question. In communication, there's two people, right? So there is, and in this case, the clinician or the nurse and the client. And how can a nurse or the clinician dissociate from their own personal experiences or feelings when they're listening to someone else, particularly if someone else is talking about something very emotional or traumatic that may be activating to them, and they're maybe not prepared for how it's raising some emotions for them?
Yeah, I think that is a very challenging experience to be in. I think when you are in the moment and something has caught you off guard, that is either bringing up emotions, that is reminding you of something in a personal way that is going to make it challenging for you to listen. I do think we can, where we can, we need to address those potential instances in that preparation phase. And so knowing what you might be walking into can be very helpful. So if you know that a disclosure of child maltreatment may be activating for you, prepare yourself. We likely, as clinicians, luckily know a little bit about the family or the client that we're going to be working with. And so if you see, in case history or in the chart details, other documentation, that there may be something that is going to elicit that response in you, prepare for it. I think that can be one of the most helpful things to do. And it can be well in advance that we're kind of continually doing this, whether it's the reflective supervision or our own self reflection and reflexivity on certain instances and certain cases that help us really manage our own emotional responses. We can be preparing in that way, but I think we can also be preparing in those initial moments before we enter a door, before we make a call, where we are, again, is it some deep breaths? Is it a grounding exercise that's going to help us be in a better space when we do have those emotions come? And I don't think nurses and clinicians should be emotional. That's part of the connection. And so I do think if emotions do arise, it's having that open and honest conversation about them and letting the client know potentially how you're feeling, and that you may need to take a moment, or that that you're feeling emotional, and you can explain maybe why that is. It's that therapeutic use of self. It may be something that as actually you can really connect with your client about. But I do think preparing, again, we know the situations that we may walk into that are going to be difficult, and maybe difficult for us based on where we are at emotionally, mentally, physically in that moment, or maybe based on some of our historical perspectives, our own personal experiences.
Okay, there are so many great questions here. I'm going to ask you two last quick ones.
Okay.
Your client won't stop talking, and they continue to talk and talk and don't stop. And how do you recommend responding to them? And how is it appropriate to say to them, I'm listening, and that at some point that you do want to provide a little bit of a response?
That's a good question and a tricky situation. My counter argument, or my counter question, would be, do we need to respond in this situation? Or maybe we actually need to, this client needs to talk and talk and talk. Or what are we listening for? Have we come to this situation with our own maybe agenda that we need to maybe let go for this session, for this appointment, because the client needs to talk and talk and talk, and maybe we're not going to get that item that we had planned to get done today done. And that's why when I had that realization that listening and sitting and really what felt like doing nothing in an acute care environment, I was doing everything for this family. I really had that realization that I maybe have nothing to account for my 12-hour day on a checklist or a tool, but I've done everything for this family, and just letting them talk, letting them be silent, letting them cry. And so I would maybe push back that maybe you don't need to respond in that situation. You maybe need to give a prompt when you're going to have to leave and thank them for everything that they shared. Or the summary at the end, summarizing what has what they've shared and what they've talked about, and maybe that's where you can maybe put a plug for what the agenda of your next interaction may be. We didn't get to this and this today, but I really heard that you needed to share about these things, and we can get to that next time. It doesn't look good on a checklist, but I think it at the root of active listening in our trauma and violence informed care, it's what we need to be doing.
Great. And again, I apologize to everyone. We have so many great questions here. I won't get to all of them, but a single last summary one for you is, what is your ultimate recommendation for clinicians and nurses for moving away from always wanting to provide a solution-focused response, that advice or guidance? How do we start to move away from that natural inclination for many of us? And not just automatically wanting to be providing solutions to a client's concerns?
I think part of it comes from that systemic level of being permissed to not get something done in that day. And as soon as we feel that permission, I think it can really start to flip the script on how we see our interactions, and yeah, that it's okay to have just listened and that sort of thing. I can also, that the How to Nurse book by Donna Varco, I've got 2 copies sitting behind me. It really has some, like, if you want to dive really deeply into this topic, that's my recommendation.
Great, thank you. And today you've really summarized how critical listening and understanding is as doing and as intervention. So thank you so much. And Liz, this has been incredible. As we wrap up today's webinar, I'd really just like to thank you for presenting, and thank you to Andrea for co-moderating with me. I'd also like to thank everyone who has joined us for today's Public Health Ontario webinar. After the webinar, you can expect to receive a brief and anonymous survey for today's session. Please try to complete this to continue to help us improve our programming and to identify new topics that are very practical to help enhance your practice. Our next webinar will be on April 12th, 2023, and registration will be coming shortly. The topic is From Breast is Best to Fed is Best, a trauma and violence informed approach to caring for and supporting women with infant feeding. A reminder too that the Ontario Public Health Convention is going to be held on March 27th and March 30th. And to register for this conference that is virtual, for the virtual convention or the in-person workshops, please visit the website that is in the link. And lastly, to access past presentations and to view confirmed upcoming sessions, please visit the Public Health Ontario website or the PHN Prep website and head to Education and Events and click on Presentations. So thank you, everyone. Thank you, Liz. Thank you, Andrea. And I wish everyone a really wonderful Wednesday. Thank you. Goodbye.